And introduce our next speaker here, Dr. Rizvi. This is another colleague of mine from Mayo Clinic in Rochester, Minnesota. He's from the Division of Hospital Internal Medicine. Dr. Rizvi is board certified in geriatrics and palliative medicine, so it's very fitting that he's here today to talk to us about the management of pain in inpatients.
Thank you, friends, and those of you who are sacrificing your joy of sunshine and sitting here, I truly admire and appreciate your courage. So if there is one talk where you could absolutely shut your syllabus, put down the phones, and just pay attention to the statue and god of handsomeness, this is the one. The reason being that I've been reported by previous course attendees that my voice echoes in their nightmares about when I emphasize on a point, and that's the whole purpose. There's hardly anything in this talk that you haven't heard before. So for those of you who are new to your clinical practices, you'll learn something. For those who have been established in practices for over 10 to 15 years, I think it'll just be a gentle reminder of safe prescribing practice. So we are going to talk about inpatient pain management. How do you engage a patient who's coming in with pain while you're working in the hospital? That's exactly what I just described the title. I have no disclosures, none whatsoever. Nobody pays me. I just say what comes to my mind. I just have to acknowledge my great, wonderful mentors and friends, Dr. Keith Sweats, who's now at the University of Alabama, and all my wonderful pain and palliative care colleagues who I've learned tremendously from. So the objectives are really simple. First of all, a good pain assessment and a good pain plan can never be complete until you have understood what the barriers are to ineffective pain control. We'll look at some CDC guidelines for chronic pain and some pointers to remember. The key emphasis is going to be around the principles of opioid management and opioid conversion, which I run into a lot of new prescribers just prescribing in ways that you kind of cringe, why did that happen? So that's what we're going to emphasize on. And then finally, review some non-opioid analgesics and non-drug pain treatment plans, so that when you think of pain, opioids are not just always the only answer that you have in mind. Pain facts, let's start there. So every year, there are about 116 million Americans who are struggling with pain, coming to your outpatient clinics, coming to your hospitals, coming to the EDs. That's the most common reason why somebody seeks medical care in the emergency department. And in cancer patients with metastatic disease, that prevalence is even more. And about half of them will just never get their pain